Hi everyone. Today we're going to talk about how panic attacks affect the heart. I'm interested in this topic because I've experienced panic attacks before myself and I want to know the science behind it. But first, let's get into some background information so that you guys understand more what I'm talking about. A panic attack is defined as the abrupt onset of intense fear or discomfort that reaches a peak within minutes and includes at least four of these symptoms, which include palpitations, pounding heart, accelerated heart rate, sweating, trembling, shaking, sensations of shortness of breath or smothering, and several more. You can also experience a limited symptom panic attack, which, just as it sounds, has a limited number of symptoms, meaning less than four. The intensity of a panic attack can also reach peak level in 10 minutes or less and then slowly dissipates over time. When one has a panic attack, it can affect many different body systems in many different ways. The integumentary system can be affected through sweating, chills, and hot flashes. In the respiratory system, you experience shortness of breath. In the nervous system, you experience a fear of loss of control or death, a sense of danger, and sometimes a feeling of detachment from the world. And then in the cardiovascular system, you have chest pain and a rapid heart rate. And then in the muscular system, there's cramping, which can occur in many different parts of the body. Unfortunately, anyone is susceptible to experiencing a panic attack, but the people who have them the most or are most susceptible to them are those who struggle with anxiety disorders, depression, or any type of panic disorder. On top of this, there are many risk factors or causes that could affect your probability of experiencing a panic attack. Some of these include a family history of panic attacks and disorders, a major life stress such as a death or serious illness of a loved one, recently experienced traumatic events or PTSD due to that, major life changes, and then smoking, excessive caffeine intake, or drug use. During a panic attack, your body goes through many different processes, but I want to focus on what happens to your heart. In the early stages of a panic attack, the hormone adrenaline floods into your bloodstream. As this passes through the veins of your heart, also known as the inferior and superior vena cava, your heartbeat quickens. This means your heart is working harder and faster to pump blood into your body, which also sends more blood to your muscles, which is responsible for some of the symptoms you experience during a panic attack. Studies have also shown that as early as 45 minutes before a panic attack, your body experiences low levels of carbon dioxide and rapid, deep breathing, which leaves you almost breathless. This means there's a decreased amount of oxygen in your body, so your left atrium and ventricle are lacking oxygen-rich blood, something that is very important in keeping the cells throughout your body healthy. A panic attack's interference with your cardiovascular system is dangerous for your heart's short and long-term health. A study was recently done with over 1 million men and women, and the results showed a link between panic attacks and heart disease. This is still a somewhat controversial link, but is still of a concern. It has been said that the symptoms of panic disorder represent a misdiagnosed heart condition in some people. This possible connection between panic disorders and coronary heart disease is definitely not something to ignore, and it is suggested for people who experience panic attacks to keep a close eye on their heart health. The topic of how panic attacks affect a person's heart is very closely related to our cardiovascular unit that we covered in class. This video will hopefully further show how much the cardiovascular system impacts the body overall. Panic attacks begin with the heart, and what follows is a series of bodily changes and symptoms, which send the body out of homeostasis, another topic we learned about in class. Overall, panic attacks have a much greater effect on the body than many realize. If you're like me, you probably thought that the effects and symptoms of a panic attack only lasted as long as the attack or episode did. But now we know that a panic attack can have a long-lasting effect on the body, especially the heart and the rest of the cardiovascular system. So keep an eye on your heart health. I'm sure Miss Maris would want you to.